Hello, welcome to this presentation about understanding and evidencing the new HCPC standards of proficiency. My name's Sue Jones and I'm Executive Head of Education at the IBMS, and I'll be presenting the slides to you in this video. The Health and Care Professions Council, or HCPC, define the standards of proficiency as the professional standards that all registrants must meet in order to become registered, and they must meet them in order to remain on the register. The standards of proficiency are there to set clear expectations of all registrants' knowledge and abilities, both when they start practicing and also once they are on the register. It is expected that registrants will continue to meet the standards of proficiency that apply to their scope of practice. The HCPC updated the standards of proficiency in 2022, and these new standards come into effect from the 1st of September 2023 and replace all previous versions. Both the standards of proficiency for biomedical scientists and the standards of proficiency for clinical scientists have been updated, and the updated wording can be found on the HCPC web pages as shown in the links below. They're available as PDF documents to show what the new standard wording is, and also as a comparison document of the old standards from 2014 compared to the new standards from 2022. So it should be really clear if you look at those documents how the standards have changed, which bits are different, and you should be able to see what the new standards contain and what you would need to do to be able to demonstrate that you meet them. The reason I mention the clinical scientist standards of proficiency is it affects the IBMS's Certificate of Attainment for Clinical Scientists. This is an equivalence route for people who are already working at a level that's equivalent to a clinical scientist and wish to evidence that they are working at that level in order to obtain the Certificate of Attainment. This equivalence route can be met by evidencing what that colleague is currently doing in the workplace as a portfolio of evidence, and they will put that forward against the new updated standards from the HCPC. The portfolio of evidence that's submitted will be assessed by a clinical scientist in the correct discipline, a biomedical scientist in the same discipline, and also by a layperson as the review panel. If the portfolio of evidence that's been submitted passes, then the candidate will have a viva voce or an oral examination as their final assessment, and that's a discussion about how they do meet the standards of proficiency in their everyday work. If successful, the Certificate of Attainment for Clinical Scientists will then be awarded to the candidate by the Institute, and the candidate can apply to the HCPC to register as a clinical scientist. Of course, the new standards being updated will also affect the registration training portfolio. So the IBMS registration training portfolio is mapped closely to the HCPC standards of proficiency. If we look at the table on this slide, it shows the number of certificates of competence that have been issued following successful completion of the registration training portfolio, and also an appropriate degree programme in the last 5 years. So we can see in the middle column, the number of certificates of competence that have been issued is by far more than the Certificate of Achievement, which is issued to support workers, or the Specialist Diploma Certificate, which is given to people who are working at a more specialist level and complete the specialist portfolio. So we have a large number of people every year who complete the registration training portfolio and will evidence within that how they meet the HCPC standards of proficiency. Why does everybody need to know about the HCPC standards of proficiency? It's important if you are undertaking training to complete the registration training portfolio. It's also important if you are a trainer who is advising and supporting and mentoring a candidate to complete the registration training portfolio. But as we are in a renewal year this year for HCPC registration, anybody who is a registrant as a biomedical scientist or a clinical scientist could be asked to evidence how they continue to meet those standards. If you were selected for a CPD review, you will be asked to evidence using your CPD how you can still maintain your standard of proficiency against the ones that are listed for each of the professions. We have an IBMS support hub in October, which is about being selected for CPD review, how to approach completing the review, and how to do that successfully. So whether you're involved in training and mentoring, whether you're completing a registration training portfolio or whether you're selected for a CPD review, it's important that you understand all of the new standards that we have for both biomedical scientists or clinical scientists. The HCPC regulate 15 different professions in the UK. 2 of those professions are biomedical scientists and clinical scientists. The standards of proficiency wording is generic across all of those different 15 professions. The 15 different headings that we have within the standards of proficiency are shown on the next 3 slides. The first 5 of the standards of proficiency are shown on this first slide here, and you can see that I've marked with an asterisk number 3 and number 5. The reason that these have been marked are these are 2 of the areas that have been expanded or added to in the updated standards of proficiency wording in 2022. The first area that was expanded is the need to look after health and well-being and seek appropriate support where necessary for registrants. And number 5 is recognising the impact of culture, equality and diversity on practice, and also demonstrating how registrants practice in a non-discriminatory and inclusive manner. On the second slide that shows the next 5 of the 15 subheadings, we can see that we have 6 to 10 of the headings shown. None of these have changed substantially in the updated wording for the standards of proficiency for biomedical scientists or clinical scientists in 2022. Overall, the number of standards has increased, but there are no major changes to any of the areas which are listed on these slides. Each one may have got a few new standards included, but generally they are very similar to what was in the previous versions. On this next slide, we can see the last 5 of the 15 subheadings for the standards of proficiency, and we can see again that the bottom one of these 5 shown on the slide, number 15, promoting health and preventing ill health, is marked with an asterisk. So again, this is an area which has been expanded in the new standards of proficiency and includes more standards that will need to be demonstrated for people who wish to become registered as a biomedical scientist or clinical scientist, or for those who are already on the register who wish to maintain their registration. So what we will do in the next few slides is have a look at exactly what the changes to the wording are and which different areas they affect. The most important and first thing to note about the standards of proficiency update is that the wording has changed in how people are asked to demonstrate those standards of proficiency. The updated wording from 2022 talks very much about demonstrating that you do things in practice. It's not about having an understanding or knowledge of, it's not about having been trained in something and attended something. It's about how you demonstrate in your practice that you do the things that are listed in the standard of proficiency. Those are the difference in emphasis in how you might evidence that you are somebody who can demonstrate those different standards of proficiency. The first thing that I highlighted was the importance of maintaining fitness to practice, looking after your own mental health and seeking help where necessary. This has been expanded so that it will show that registrants not only look after their physical health and well-being, but also after their mental health. And if there is any stress or anxiety, that the registrants know where they can find support and they are able to do that successfully so that it doesn't affect their ability or fitness to practice. There's much more on equality, diversity and inclusion, or EDI, in the updated standards wording. Previously, there were only 3 standards of proficiency that were directly related to EDI, and there are now 15. So there are many more standards that need to be demonstrated, and again, it's about how you demonstrate through your behaviours and actions that you are aware of issues to do with equality, diversity and inclusion, that you work in a non-discriminatory manner, and that you understand any barriers to inclusivity that you may come across in your workplace, in your practice, when dealing with stakeholders. That central role of the service user is still very much part of the standards of proficiency, but what has happened is that the importance of informed consent and effective communication with service users has been expanded in the new standards of proficiency. The HCPC wording also very much frames the service user as the patient, not just other stakeholders or other service users across different disciplines in pathology. So what we will need to do to demonstrate this standard of proficiency is to use interactions with patients, understanding patient data, and with the advent of point of care testing, we're hoping that this is something that everybody will be able to evidence successfully through their normal daily work. But if they can get to any clinics to have patient contact or to shadow people if they are training to do the registration training portfolio, so that they can involve themselves in meeting service users that are patients in addition to colleagues who may work outside of their immediate laboratory. The next thing which is expanded is the need to keep up to date with digital skills and new technologies. That's no great surprise. Things change all the time, whether that's to do with patient records, whether it's to do with information systems, or whether it's to do with the technologies and techniques that you might be using in the laboratory. So being able to evidence that you are up to date with the latest digital and technological advances is something that would be expected for somebody who has a very practical role like a biomedical scientist. The role and importance of leadership at all levels of practice has also been emphasised in the new standards. So this is about, if it is a trainee, it being at the right level. So it's not about a trainee or a student who's on placement or an apprentice being able to lead the laboratory. It's about understanding and identifying what makes good leaders. So what are the leadership skills that are important? How does somebody lead well? What kind of things do they do? And is there something that you could do that's appropriate to the level of the person that this is referring to? Could you give them ownership of a process or a procedure, or could you give them a piece of work to do where they look at a particular activity where leadership has been important, or reflect on their own skills and abilities, and if they have any gaps, what they might do to address those gaps in leadership going forwards? And as we've already said, the promoting public health and preventing ill health is part of the standard wording which has been expanded. So again, for all of those different professions, 15 different professions that the HCPC looks after, this is something which has been now incorporated much more fully in the wording of the standards of proficiency. As far as the registration training portfolio is concerned, this means that we needed to update the registration training portfolio to align it with the new standards of proficiency. So for this year, up to and including the 31st of August 2023, anyone who applied for a registration training portfolio was issued with the current version, which is version 4.3. This version of the portfolio is aligned to the HCPC standards of proficiency from 2014. After the 1st of September 2023, all applicants for the registration training portfolio will be issued with version 5, which is the updated version of the registration training portfolio, which is aligned to the new standards of proficiency that were updated in 2022. We've agreed with the HCPC that what we will do to bridge between people who are finishing version 4.3 and people who are starting the version 5 portfolio, that we will ask at the point of verification that all candidates are asked questions about the newly introduced and expanded areas of the standards of proficiency. So the ones that I've just highlighted on the previous slides, where the areas have been expanded, are the areas that we will ask our verifiers to ask questions about at the point of verification. So all of the candidates who were already waiting for their verification have been advised what the new areas are and what to expect questions on. And all of our IBMS trained verifiers have again been given information on the expanded areas in the 2022 update to the standards of proficiency, and to ask each of the candidates that they verify going forwards questions around what's been expanded, what's been enhanced, where are the new areas of standards of proficiency that the candidate needs to be aware of, to make sure that people, whether they complete version 4.3 or version 5, are all able to demonstrate that they understand and can meet the updated HCPC standards of proficiency. For the version 5 registration training portfolio, the requirement for 30 pieces of evidence remains the same. So across the portfolio, we have section 1 and section 2. Both section 1 and 2 contain 5 modules each, giving 10 modules in total. So the requirement for 3 pieces of evidence for each of the modules in the portfolio remains exactly the same. In section 1, module 5, there has always been a piece of mandatory evidence. This was in the professional relationships module, and it was a reflective statement which talked about professional relationships, and there were particular standards of proficiency that had to be met in the version 4.3 portfolio. What we have done with the version 5 portfolio and the updates is to introduce a mandatory piece of evidence to each one of the modules in the portfolio. So there will now be 10 mandatory pieces of evidence across the portfolio, with one of them in each of the modules to be completed. The reason that we've done this to introduce the mandatory piece of evidence for each of the modules in the portfolio is to help with scaffolding the training of our candidates for the training portfolio and to improve consistency in both the training but also in the evidence which is being put forward to demonstrate that the candidates can meet the HCPC standards of proficiency. We've been told that lots of people do this kind of training already. Across different pathology disciplines, people share their training plans and they share the types of evidence that they're expecting that will clearly demonstrate and be useful to the candidate to show how they are meeting the standards of proficiency that are listed in the modules. The details of the mandatory pieces of evidence were released in July, and we also released a mapping document to show where the standards of proficiency were going to be in each of the modules to help with training plan updates. We've also released frequently asked questions documents, and all of these can be found on the home page for the IBMS. If you go to useful resources on the landing page, you'll find the mandatory pieces of evidence description, summary tables, and the frequently asked questions about the updated portfolio as well. If you go into the registration training portfolio page, they are again listed there, so they should be really easy to find on the IBMS web pages. The mandatory piece of evidence in each case is going to be evidence 1 of each module. So the mandatory piece of evidence must be completed as it's described, and it must meet the indicated standards of proficiency. The indicated standards of proficiency have been mapped to each mandatory piece of evidence, but these are a minimum. If you can produce a piece of evidence for the mandatory piece of evidence, which will encompass and evidence more of the standards of proficiency, that's absolutely fine. The ones that are listed in the table and in the guidance documents are the minimum which need to be demonstrated by each piece of mandatory evidence. The remaining 2 pieces of evidence for each of the modules for the registration training portfolio are a free choice, as they have always been, that will be agreed between the candidate and their training officer. It's important that each of those other additional pieces of evidence adequately demonstrate the standards of proficiency for the module, and again, each of those pieces of evidence, number 2 and number 3, must be mapped to the standards of proficiency that they are demonstrating, and at the end of the module, each one of the standards of proficiency should be mapped to one of the 3 pieces of evidence. So it should be really clear to the candidate, to the training officer, and to the verifier at the end of the process which standards have been met using which piece of evidence. And of course, a variety of evidence is still something that we want to see in the portfolio. Introducing the mandatory pieces is not meant to constrain or restrict or mandate that you can only do one type of evidence all the way through. The idea with the mandatory pieces is that they are the same in everybody's portfolio, but that creativity, that innovation, and those really nice different new pieces of evidence that people might want to put forward can be used as part of the module evidence 2 and 3. Of course, having lots of variety in the different types of evidence across the portfolio is an example of good practice, and it's what we expect as we go through the portfolio to see different types of evidence being used to effectively show that that candidate can demonstrate how they meet the HCPC standards of proficiency. As mentioned on the last slide, there are new guidance documents which have been prepared for the candidate, the trainer, and the verifier for the version 5 registration training portfolio. Again, the guidance documents are all freely available on the IBMS web pages. If you go to the registration training portfolio part of the website, you will see all of the documents listed at the bottom of the page if you just scroll down to the bottom. Each of the guidance documents contains similar information, but also bespoke information to each of those individual audiences. They contain information on the sections and modules of the portfolio. They contain the learning outcomes for each of the 10 modules in the portfolio, and also examples of evidence that you might want to consider using for evidence 2 and 3, in addition to a clear description of each piece of mandatory evidence that's required per module. There are also frequently asked questions, which are in each of the guidance documents, tailored towards the candidate, the training officer, or the verifier, but they should be useful to any of those people about anything that might occur to you as you're going through completion of the registration training portfolio, whether it's gathering evidence, whether it's about the registration training portfolio verification, whether it's about organising or contacting the IBMS. Each of the modules in the new portfolio, as we've said, has one mandatory piece of evidence, and they're described really clearly in Appendix 2 of all of the 3 guidance documents. Appendix 3 of all of the guidance documents also gives those examples that you could consider to use for evidence 2 and evidence 3 in each of the modules. It isn't an exhaustive list. It's some examples that you might find useful to start you thinking. If you already have a really good piece of evidence that you know will demonstrate the HCPC standards of proficiency for that module, then by all means use it. If you need to update it slightly, so it's not just about knowledge and understanding, but it's about how you apply that to practice, then that would be a really nice piece of evidence to include. So the link to where you can find the guidance documents is shown at the bottom of this slide here. If you follow that link, if you go onto the website and look under Education and Registration Training Portfolio, you will really easily find the guidance documents at the bottom of that web page. So how can we effectively evidence these updated standards of proficiency when we are training? It's up to the candidate and to the training officer or mentor to select pieces of evidence that will cover several standards of proficiency at once. So long gone are the days where we had one piece of evidence for each of the standards of proficiency. For the version 4 portfolio that everybody has been used to since 2014, we've asked for 30 pieces of evidence which map to 105 standards of proficiency, so each one had to already cover several standards of proficiency. What we've done with the version 5 portfolio is to make it clearer which standards will need to be mapped to for the mandatory pieces and which standards are left in that module to be mapped to evidence 2 and 3. So you can see for the 2022 standards of proficiency, there are now 129 standards. So each piece of evidence is going to need to map to 4 or 5 of the standards of proficiency in order to be able to evidence all of those different standards of proficiency within the 30 pieces of evidence put forwards. The generic nature and wording of the standards of proficiency does mean that you can use lots of different evidence types, and it's flexible. The types of evidence that you put forward will adequately evidence those different standards of proficiency, and that's where the flexibility in the types of evidence and what kind of things you might want to consider comes in. All we ask is that the piece of evidence that you put forward, you've thought about, how does it demonstrate the standards that you're saying it demonstrates, and then you reference them so it's really clear to everybody which standards it is that you are showing. And of course, the best evidence in any registration training portfolio will demonstrate not just the candidate's knowledge and understanding, but how they are applying that knowledge and understanding to their practice, in their behaviours, in the laboratory. So how do they show that they live and breathe those standards of proficiency? They use them as they would do if they were a registrant. So there are certain things they can't do until they're on the register, but do they really understand and can they demonstrate how they would apply the standards of proficiency to their practice? The kinds of things that you need to think about when we're thinking about different types of evidence that might be useful for the version 5 portfolio would be thinking about evidence that does make that a really clear link between the candidate's experience and what they do in their practice. So I've listed on this slide just some examples of the kinds of evidence that you might want to consider, and these may well be things that you are already using when you are doing training, but these are the kind of things that will allow a candidate to show they've got knowledge and understanding, they've got relevant experience, they can evidence and demonstrate how they do these things in their practice, and the key thing is making it unique to that individual, making it something that they have done in the laboratory, making it something that's bespoke to them, because it's much easier then for them to evidence and to talk about it in an informed way. So the things that are covered on this slide, again, as I've said, maybe things that you do already. Reflective statements are really useful. We expect self-reflection throughout the portfolio. The candidate should always be thinking about what they've done, if they could do it better, have they got any gaps that they might want to address, what they can do. So they should always be thinking about reflection in every piece of evidence anyway. A summary of a training tutorial or a discussion is good, again, if they can talk about what was discussed, how it's helped them and how they're now applying it to their practice. So not just that they had a discussion, but what was discussed and how that has helped them in their practice. Audits or following a sample through the laboratory can be useful. If it's a diagram or if it's photographs, anonymised obviously, then that could be annotated. We expect to see lots of annotation and individuality in this kind of evidence. So not just following a sample through a laboratory and not showing their understanding, knowledge and how they have been involved in following the sample through. Feedback or a review of presentation slides. So again, not just that they have been to a presentation, but using the slides to really think about what did they learn, why was it useful to them, how are they now implementing that new knowledge into things that they're doing in the laboratory. Thinking about annotating documents or laboratory results, they could be really nice. Again, that's very individual. It's something that that particular candidate has been involved in. So if they've run a set of samples or if they've got a few different types of data that they can put together and compare results, they can talk about if there's an abnormal result. They could talk about if the analyzer or if the microscope they're using had any issues. They can bring in quality assurance to this, so they can think about what the results mean, if they work well, how they might be assured that that's happening, and what they can do if it isn't. Question and answer tutorials are fine as long as the questions are posed at the right level, there is enough information in there, and again they're quite bespoke to that candidate rather than just very generic questions they can just go and look up the answer. Diagrams and flowcharts or posters and leaflets can be really useful as well. So thinking about processes and drawing them out, annotating them, explaining again how these things are happening in the lab, where they're inputting into it, where it goes before they look at it, how it gets to them, and then where it goes afterwards. That can be a really nice way to show some quite complex information, but to annotate and to demonstrate that they really do thoroughly understand how these different things are happening in the laboratory. A case study, again, can be really nice. So thinking about something that's happened in the lab, the underpinning knowledge and understanding of what the disease might be, the etiology of that disease, how that might present itself, what would you do as follow-up for a particular sample if that was necessary, and how might you monitor disease progression. All of those things can be really interesting and can be brought out in case study type assessments that you might want to do with a candidate to put forward as a piece of evidence. Data analysis is also a good one. So if they have a set of data, it could be patient data, it could be data they've got from somewhere else, but they would look at that data, analyse, evaluate, review, explain why the data is important, where it's come from. Again, there could be a quality angle. It could be that there is something that the machine isn't working properly. It could be that the data is really good and it's better than they've had before. And how was that achieved, and how will that they take that forward into their practice? Direct observations of practice are good, again with reflection from the candidate. So somebody could watch the candidate doing something in the laboratory, have a discussion with them about what they did and how they did it, and the candidate will talk about that rather than the person saying, I watched them do it. It's the candidate's evidence. It's the candidate who is showing that they can meet the standards of proficiency. So they need to be the one talking about what they did, what they were told about what they did, and how they will adapt what they're doing going forwards. And if you do want to have any scientific pieces of writing, please make sure that they're short, clear and concise. Writing reams and reams and reams of information doesn't show that they have good knowledge and understanding. It just shows that they've gone and found information. So again, if you can make the scientific piece of writing something that's very particular to the laboratory environment or very particular to something that the candidate has done, that's a much better way to focus them and to get them to write in a clear and concise way. On all pieces of evidence that are put forward for the registration training portfolio, we like to see that the trainer or mentor has reviewed that piece of evidence, annotated it, given feedback on it, talked to the candidate about it, that we can really see that feedback loop between the trainer and the candidate. What we're looking for is that the candidate has done a piece of work, has discussed that piece of work and has used constructive feedback to try and improve it so that each piece of evidence is as good as it can be. So good pieces of evidence should show a candidate undertaking a particular task, getting feedback from the trainer or someone else in the laboratory that is looking at that particular piece of evidence, responding to the feedback, understanding what's being asked of them, understanding why that feedback has been given and what they can do to improve the piece of evidence, and then changing the piece of evidence. So we don't want pristine, beautiful pieces of evidence that don't have any of that feedback annotation on them. You can, in a digital sense, do track changes. You can add in comments in text boxes. You can use a different coloured font if everything is being done electronically. If you would rather have a hard copy piece of evidence and write on it, physically write on it, and then scan it in to upload for the portfolio, that's fine. If you are using one file for the version 5 portfolio, all of that evidence of interaction, annotation, feedback, comments, and iterative improvements in the pieces of evidence can be taken care of on the one file system. So you can choose how you show that this is happening, but when the verifier looks at the portfolio, they will be expecting to see when the candidate has done a piece of evidence that it has been improved and refined and it's been made better until it gets to the final version, and that's the best that piece of evidence can be. Don't let them print it out again with none of that feedback on, because we can't then see that that discussion and that improvement has taken place. Evidence of that feedback loop is the exact thing that we want to see. It shows that there's a good training environment. It shows that you've got a good relationship with that candidate, that they've been looked after and helped, and they've adapted their pieces of evidence as they've been learning, as they've gone through the laboratory and they've gained more experience. So it's a really nice thing to be able to see pieces of evidence that have good feedback, good annotation, and show that relationship between the trainer or mentor and the candidate. I thought it might be useful in the next few slides to talk about things to avoid when looking at evidence. So often when people are doing evidence for portfolios, they like to do things that they're more familiar with. So if it's a placement student or if it's a graduate, because everyone who's doing the registration training portfolio will be a graduate, they will have a degree or be completing an integrated degree where they're doing the portfolio. They quite like long written pieces of work because that's kind of what they're used to doing when they're doing an undergraduate degree. Writing an essay, a long written piece of work, doesn't really show that the candidate is showing you their own knowledge and understanding. What it's showing you is that they can go and find information on a generic title that they've been given and stitch it together to be a big piece of written work without actually really being their own knowledge. So they can find information and put it together into a format that looks like an essay, but actually they can't explain it to you. So writing long written pieces is not a good piece of evidence to use. It's time consuming for them to write, it's time consuming for you to mark and to give feedback, and it's also time consuming for the verifier. As we said, being clear and concise and being able to reduce lots of very verbose writing into a shorter piece of evidence is a much better skill to develop. Picking out what's important and using that in the final piece of evidence is a much better skill to develop. Also, with AI and ChatGPT, it may not even be that person's writing. So if you give them a very broad topic to go and research and to get information on, it may not even be them that's written it. So it's much better, as I've said before, to give them a piece of work to do, if you do want to give them a written assignment, that's very bespoke to them, to the laboratory, to something that they've done, to a patient set of data, something that means it's not something that they can go and find from an open resource very easily. They might do some extra reading to help with their knowledge, but it should be that they can explain to you what it is that they've written in the piece of written work. As far as seminar slides or training slides or course certificates are concerned, it's not the piece of paper that we're interested in. As a piece of evidence, if a set of slides are put in with no annotation or no analysis, no reflection on what the person learned from going, it's not a very useful piece of evidence. Putting in a certificate that says I've been on a training course doesn't actually tell us anything. So we don't want to have a piece of paper that says they've been somewhere or they've seen something. What we want is a piece of evidence that talks about why that was useful. What did they learn by doing that particular activity? Why did they choose to do that activity to start with? Were they aware there was something that they needed to address in their knowledge, understanding, or in their lab capabilities? Was it useful to them? What did they learn from doing that particular activity, and how are they now using that to help to improve their practice in the laboratory? That's much, much better as a piece of evidence rather than just saying I've been somewhere, to say this is why I went, this is what I did, this is how I'm using it in my practice. This has helped me to improve. I know I still need to do X, Y, and Z to get better. That's a much better piece of evidence for somebody to put forwards. Witness statements in and of themselves are not good examples of evidence. So the pieces of evidence in the portfolio should be the candidate explaining how they are meeting the standards of proficiency. They need to be able to show that they can meet the standards of proficiency and demonstrate that they do them in their practice. Someone else writing that they saw them do something doesn't show that at all. So instead of a witness statement, we would ask that the person is, as we said, maybe does a direct observation of practice where they will do something and somebody has watched them do that and talks to them about it. So the witness statement itself is not a good piece of evidence, but if that's adapted so that there's a summary of a discussion between the person who observed the task being done and the candidate, and they talk about what was done well, things that they could improve next time, why they may not have done something quite right, or if they did it really, really well, give them that feedback, enhance what they're doing and ask them to share that good practice. So there's lots of different ways that you can talk about a task being done, something performative in the laboratory, but that the candidate is very much involved in the description of that work and what they've learned from it. And again, in the laboratory, in their practice, how it's helping them to develop. All of the candidates who are doing the registration training portfolio have to sign a plagiarism statement to say that the work in the portfolio is their own. We've strengthened that statement in the version 5 portfolio that will be hosted on OneFile, and that statement says that it is always their own work and they haven't plagiarised anything. When a person is doing a piece of writing, the more it is bespoke to them and the less it is generic, the harder it is for them to plagiarise or to do academic misconduct. All of the people completing the portfolio will be aware of what academic misconduct is and what plagiarism is, because as I've said, they are all graduates or they are all completing an undergraduate degree as they're working their way through the portfolio. They will have been told in modules at university what plagiarism is and how to avoid it, how to reference properly, how to put citations in, how to acknowledge where a particular resource has come from, whether it's a diagram, whether it's something that's taken from the internet, a picture, something from manufacturer's instructions. They should know how to reference source material, and they should know that they need to write things in their own words and not copy directly from sources without acknowledging where it's from. Even if they do take text and they insert it without changing it, put it in quotation marks and add a reference, that's poor academic practice, because they should be able to explain to you in their own words what that information is. They shouldn't need to quote from any sources. They should be able to explain to you what that thing is they're trying to describe. It's very easy when people are writing to cut and paste material and put it down onto a piece of paper and then forget to reword it. So speak to your candidates about how they're finding information, where are they getting it from, and making sure that they do rewrite it in their own words so that it's their explanation and it's their knowledge and understanding and their demonstration of what they do in practice and not just something that's taken from another source. As we said, each piece of evidence that's put into the portfolio should map to several standards of proficiency. So the question I've been asked quite a lot is, how big should each piece of evidence be? If we're mapping to several standards of proficiency, does that mean that each piece of evidence is going to be huge? And the answer to that is no. Each piece of evidence, every time one is created, the candidate and the trainer should be thinking quality rather than quantity. So it's about how good the piece of evidence is and how clearly it demonstrates which bits of the standards of proficiency it's being mapped to, not that it's about 10 pages of something. We don't want any piece of evidence to be that big. It's an important skill, as I said, to distill down in complex scientific information into a clear and concise piece of evidence, whether that's a diagram, flowchart, some photographs, whether it's data analysis or whether it's a written piece of work. It's really important to be able to pick out the important bits of information, keep those and get rid of the things that you don't need, get rid of the repetition, and to have a really clear, concise, useful scientific bit of work. So to be able to develop that skill, it may be that the candidate starts with a larger piece of evidence and they work through several different iterations of it and versions of it, and they start with a draft that they redraft 2 or 3 times before they get it into the format that you're both happy with. Again, all of that refining, updating, reducing the size of the evidence is useful as part of the portfolio evidence production. So whatever piece of evidence the candidate wants to use, even if it starts off quite big, it should be reduced down so that it ends up being a manageable size. Remember, the indicative time to review the portfolio evidence for the verifier is 90 minutes. So the pieces of evidence should be 2 to 3 pages if they're a written piece of work. That doesn't apply if you've got images, diagrams, things that are being annotated. But if it's a written piece, we would recommend a word count of 1,500 to 2,000 words. So that will be between 2 and 3 pages, depending on the font size, depending on the spacing. But 2 to 3 pages should be plenty for somebody to write a very good, clear piece of scientific writing. That would exclude any reference list, or if you wanted to, because it's digital, you could include hyperlinks for the references. You don't need to have a reference list, but the person should clearly evidence where they found information from, either as a hyperlink or as a reference list at the end, not a bibliography. There should be clear citations within the text of where the information has come from, but we would expect for a written piece of work, not with images, not with diagrams, not structured questions and answers, but a scientific bit of writing, to be no more than 1,500 to 2,000 words. The other question that I'm asked a lot is, why do we need to evidence all of the HCPC standards of proficiency? And the answer to that is because the HCPC themselves say so. So the HCPC say the standards of proficiency are the threshold or entry level of standards that they consider to be necessary to protect the public. So anybody who wishes to become a registrant for the HCPC must be able to evidence clearly that they meet all of the standards of proficiency for their profession. So in the registration training portfolio, all of the standards of proficiency for biomedical scientists have been split between section 1 and section 2, and in modules 1 to 5. Each of the people who are completing the registration training portfolio must show where and how they have demonstrated that they can evidence how they meet each of the standards of proficiency. Previously, the wording wasn't terribly clear about whether you did or didn't need to meet all of the standards within the portfolio. We've clarified that wording to say that you absolutely need to show how you meet each standard of proficiency, all of the 129 standards of proficiency for biomedical scientists, through the 30 pieces of evidence that are submitted as part of the registration training portfolio. So all of the candidates who are putting themselves forward to be verified for the registration training portfolio will have within their portfolio the standards of proficiency, which piece of evidence is being used to demonstrate that they're meeting that standard, and they will evidence all of the new 129 standards of proficiency through their 30 pieces of evidence. So when the verifier is filling in the report form, they can tick to say, I can see all the standards for this module have been met, and then they will write comments on the pieces of evidence and how they've been used to demonstrate that that particular candidate does meet the standards of proficiency. So the last thing for me to say is thank you so much to everybody who is a training officer or supports training of people in our IBMS approved training laboratories across the UK to enable them to do the registration training portfolio and to demonstrate the standards of proficiency. Thank you also to all of our IBMS trained verifiers who carry out verifications across the UK in order to make sure that the standards are maintained wherever that person has done their training across the UK. I hope the information has been useful in the video. If you do have any questions or queries, you can send them to the IBMS using the web page inquiry form. If you want to have any particular questions addressed, we can update the frequently asked questions to reflect things that have come in. So thank you so much for making time to listen to the video. I hope it's been useful to you, and I hope that I'll see you soon in a training event or at a live event for the Institute.